Hello, man. Good morning. Introduce myself. My name is Esther Yulitaina Padeda. I'm class level 1 regularity. Here I will explain about sexuality and sexual health. Introduction. Number 1. According to WHO, uh, reproductive and sexual ill health accounts the global burden of ill health. For women, 20% and for men, 14%. Atau menurut WHO untuk wanita 20%, untuk pria 14%. Number 2, it is closely related to other aspects of health. Love, affections, and sexual intimacy all play a role in healthy relationships. Number 3, sexual health is not just limited to absence of disease or dysfunction during the productive years. It impacts on sexual practice and action and must be practiced free from sexual abuse or discrimination and requires integration into the whole life cycle. The word sex denotes whether a person is male or female or sex difference, but sexuality is related to sexual behavior, gender consciousness, and sexual nature. Next, definition. Number 1, sexuality or Indonesian sex. The characteristic quality of the male and female reproductive elements. Number 2, sexual health or Indonesian kesehatan seksual. In 1975, WHO defined sexual health as integration of somatic, emotional, intellectual, and social aspects of sexual being in ways that are positively increasing and that enhances personality, communication, and love. Sexual growth and development or Indonesian pertumbuhan dan perkembangan seksual. Number 1, chromosomal linkage. XX chromosomes combination products of female. XY combination is male. Number 2, establish of gonadal sex. Number 1, second stage of sexual differentiation occurs by about the 10 years to 12 years week of gestation. Number 2, the male determining factor is Y chromosome leads to development of internal testes from gonad medulla. Without the male factor, there is development of internal ovary from the gonad cortex. Number 3, establish of phenotypes. When additional internal and external genital organs develops and result in actual characteristic of biology sex. This is critical time in sexual differentiation because each fetus develops both Wolffian and Mullerian genital duct system, one of which must develop, other regress through to product actual male or female external genitalia. The Wolffian duct system in the presence of testosterone give rise to epididymis, the vas deferens, and seminal vesicle in male. The Mullerian duct gives rise to the female fallopian tubes and the uterus and upper part of vagina. A characteristic of sexual healthy person uh, or Indonesian ciri-ciri orang yang sehat secara seksual. Number one, person who have knowledge about sexuality and health. Number two, one who has positive attitude towards body image. Number three, ability to express one's full sexual potential. Number four, capability of express sexuality. Factors affecting sexual health or Indonesian, faktor yang mempengaruhi kesehatan seksual. Number one, biologis factors. Macam-macamnya. Number one, congenital abnormality, old age and sickness, injuries, less secretion of hormones, pain and fatigue. Next, environmental factors, change lifestyle, lack of proper place and privacy. Next, psychological factors, disturbance and obstacle in family relationship, incomplete sexual knowledge, initial sexual experience being bitter, disinterest and disclicking for partner, unnecessary hopes and expectation from partner. Next, hormones and genetic factor can affect sperm quality, products of ovulation, or failure to ovulate, irregular menstrual cycle. Sexual health history, multiple partners, infectious disease, such as mumps after puberty cause sterility. Stress, physiological stress or depression, anxiety. Physiological stress, nervous lack of energy. Effects of medications: alcohol, alpha blockers, amphetamines, anticonvulsant, diuretics, marijuana. Classification of sexual disorders. Number one, gender identity disorders. These disorders are characterized by disturbance in gender identity, the sense of one's own masculinity and femininity is disturbed. Transsexualism, dual role transvestism, intersexuality. Number two, psychological and behavioral disorders. Disorders of sexual development and maturation include disorders where sexual orientation causes significant distress to the individual or disturbance in relationships. Number three, paraphilias. Paraphilias, or also known sexual perfection and sexual deficient. Number two, it is used to identify repetitive or preferred sexual fantasies of behaviors that involve any of following. Types of paraphilia. Fetishism, the use of non-sexual of or non-living objects or part of a person's body to gain sexual excitement. Masochism, the recurrent urge or behavior of wanting to be humiliated, beaten, bound, or otherwise made to suffer. Voyeurism, the recurrent urge or behavior to observe an unsuspecting respondent who is naked, disrobing, or engaging in sexual activities or may not be sexual in nature at all. Treatment or paraphilias. Psychotherapy, long-term individual or group psychotherapy is usually necessary. Pharmacotherapy, anti-androgenous. Intramuscular medroxyprogesterone acetate, 2 to 5 until 10 milligram day. Number 4, sexual dysfunction. It refers to problem during any phase of sexual response cycle that prevent individual or couple from experiencing satisfaction from sexual activity. Causes of dysfunction. Number 1, physical causes, diabetes, heart and vascular conditions, chronic kidney and liver disease, alcoholism, drug abuse. Number 2, psychological causes, work-related stress and anxiety, marital problems, feeling of guilt, effect of past sexual trauma. Categories of sexual dysfunction. Number 1, primary sexual dysfunction, a person included who have never experienced satisfying sexual response. Number 2, secondary sexual dysfunction, a person included who has satisfying sexual response earlier but is suffering from sexual dysfunction now. Types of sexual dysfunction. Dysfunction of male, erectile dysfunction, premature ejaculation, related ejaculation, inhibited sexual desire. Dysfunction of male, primary orgasmic dysfunction, secondary orgasmic dysfunction, vaginismus, diminished lubrication, dyspareunia, lack of desire. Nurses' role in sexuality and sexual health, or Indonesian, perawat dalam kesehatan seksual. Yang pertama, selama beberapa dekade terakhir, perawat telah meningkatkan peran mereka dalam layanan perawatan kesehatan seksual dan produktif. Yang kedua, perawatan kesehatan reproduksi dan seksual atau termasuk reproduksi, aborsi, dan teknologi genetik merupakan bagian integral dari keluarga, individu, dan layanan masyarakat yang disediakan oleh profesional lainnya dalam sistem perawatan kesehatan. Sekian dan terima kasih.